Hi everyone, I'm Dr. SARA CUCCURULLO, better known as Dr. C. I'm the Chair, Residency Program Director, and the Medical Director for the JFK Johnson Rehabilitation Institute. We're so excited that you're here today to learn about our residency program in physical medicine and rehabilitation. An important part of your training is to learn about the facilities and to meet some of the faculty. Today, our seniors will take you through our Rehabilitation Institute, and they'll share with you the facility itself, but more importantly, they'll introduce you to our amazing faculty. It is truly like a family here at JFK Johnson Rehabilitation Institute. We put the patient at the center of all that we do. This amazing culture is a big reason why I stayed on. I myself did my residency here and have been here since. We hope you find this informational tour informative, and we wish you all the very best. Thank you.
Hello and welcome to JFK Rehab. Some of the residents and I will be giving you a virtual tour of our facilities and introducing you to some of our distinguished faculty. We hope that this video will give you a great insight into what it's like to work at JFK Rehab. So let's follow along. We are located in Edison, New Jersey, which is less than an hour away from NYC, Philadelphia, 3 international airports, and of course, the Jersey Shore. The program offers 4 advanced positions per year for a total of 12. JFK also offers 2 one-year ACGME accredited fellowships in brain injury medicine and pain medicine. All of our faculty attendings hold academic positions in both Rutgers Robert Wood Johnson Medical School and Hackensack Meridian School of Medicine. Residents and attendings educate medical students from these programs when they rotate with us. Our dynamic academic and clinical curriculums provide residents with a breadth of knowledge in all areas of PM&R, as well as exposure to diverse clinical cases in both our inpatient and outpatient settings over the course of 3 years. As of June 2019, JFK Johnson Rehabilitation Institute adopted EPIC, electronic medical records, which is found across all HMH hospitals, allowing for more efficient and accurate chart reviewing and easier access to patient information. The tour will be structured to follow our class schedule from PGY 2-year to PGY 4. Each rotation generally lasts 13 weeks or about 3 months, allowing for excellent continuity of care and less turnover. So as a PGY 2, you will complete 12 months of ACGME requirement for inpatient rehab. One of the rotations will be through the Brain Trauma Unit, or BTU. Our brain injury program is one of only 16 programs nationwide selected as a model system for TBI rehab. Dr. GREENWALD is board certified in brain injury medicine, and he is the medical director of the Brain Trauma Unit. He is also the fellowship director of the ACGME accredited TBI fellowship. Dr. Malone is also a board-certified brain injury medicine attending physician who you may rotate with at the BTU. Every 3 months, the resident at the rotation switches attending with the TBI fellow who also rotates with these distinguished individuals. You will also rotate in the stroke and neuromuscular unit with other brain injury medicine board-certified physicians, Dr. GREISS, who has been extensively involved in resident education, and Dr. Moore, who completed his TBI fellowship here at JFK. Dr. GREISS is also the director of our outpatient concussion clinic, which you will have the opportunity to rotate in your senior years. Residents will also be extensively trained in spinal cord injury rehab with Dr. BEVERLY, who is fellowship trained and board certified in spinal cord injury. You will learn about the specialization and all the equipment that's used to allow for safe therapy practices and transfers of patients. You'll also be exposed to general rehab, cardiopulmonary rehab, and musculoskeletal rehab with Dr. JAFRI, who is the director of cardiopulmonary rehab and an associate fellowship director for the ACGME accredited pain medicine fellowship. You will also rotate with him as a PGY 4 in his chronic pain clinic. And on the inpatient side, you will work with Dr. MARKOS, a prior graduate of JFK, who's developing a focus on Parkinson's rehab. There are a lot of benefits for residents being attached to an acute care hospital. We have a 24-hour code team ready to assist with any medical emergency. And if a patient ever decompensates or requires more acute medical attention, they're able to be transferred directly upstairs to the acute care side of the hospital. So that was a brief overview of our PGY2 year and its curriculum. Now moving on to our PGY3 year.
So as a PGY3, you will rotate with Dr. ESCALDI in the outpatient spasticity clinic, where you will have the opportunity to perform both botulinum toxin injections as well as baclofen pump refills. Dr. ESCALDI is the director of our outpatient spasticity clinic, as well as a member of an international group of specialists who train other physicians in spasticity management. You'll also gain a lot of hands-on experience due to the one-to-one resident-to-faculty ratio. Also in the PGY3 year, you will have the opportunity to work with Dr. Ers, where you will assess the rehabilitation needs of patients in the acute care setting, E&M billing, as well as exposure to consult-based practice, rotating with him in the acute care portion of JFK Medical Center. Dr. Ers is also QBI board certified and runs the tracheostomy course taken at the beginning of the PGY2 year. Nearly 50% of our referrals for inpatient rehab at JRI come from JFK Medical Center. And then in the PGY3 year, you'll also have the opportunity to work with several physicians as part of your triple rotation. So the triple rotation is such where you spend 1 month at Kessler Rehab in West Orange. Over there you will get exposure to ventilator-dependent spinal cord patients. And then in Children's Specialized Hospital where you get exposure to pediatric rehab. And then you also spend 1 month at a private orthopedic surgeon's office who is board certified in orthopedic surgery and fellowship trained in sports medicine. In his clinic, you'll have the opportunity to perform dozens of joint injections as well as joining him in the OR for various procedures. So in the PGY3 year, you will also work with Dr. Brown, who is a highly trained specialist in musculoskeletal and electrodiagnostic medicine with AANEM certification and board certification in PM&R and sports medicine. He directs the EMG clinic where you will rotate with him twice, once as a PGY3 and once as a PGY4, for a total of 6 months. You will easily exceed the 200 EMG requirement over the course of your 2 years with Dr. Brown, and most of our seniors average around 300 prior to graduation. Our seniors graduate confidently able to perform EMGs independently.
Alright, welcome to PGY4 year. So during your senior year here, you have 3 months on elective. One of those months can be done in an outside facility, allowing you to showcase your skills at other programs, especially for those applying to fellowships. For 2 weeks of the elective, you also work in our aftercare program in stroke recovery. Dr. Bagay and Dr. Luke are part of our aftercare program, and this is directed by Dr. TALYA FLEMING, overseeing the care of the post-acute patients as they transition from the inpatient side to outpatient. They are vital parts of our stroke recovery program, a progressive research project headed by our very own Dr. SARA CUCCURULLO and Dr. FLEMING. This is a very clinical endeavor utilizing cardiovascular conditioning for patients post-stroke. This comprehensive program is also being done hoping to improve the medical care support for outpatient therapy for patients following stroke. Dr. Bagay, who is the director of our cancer rehab program, as well as Dr. Luke, work with patients in the aftercare, stroke recovery, and cancer rehab programs. Residents spend a total of 2 weeks of their elective time in this outpatient practice, and where they can gain experience at a subacute rehab facility with Dr. Bagay as well. As a PGY4, also you will rotate with Dr. UUSTAL, who directs our P&O clinic here and is nationally renowned in P&O management. You work alongside him, as well as individuals who make the braces and orthotics, as well as therapists treating this kind of population. You will receive training in wound care management as well and see patients on the inpatient unit. You also rotate with Dr. Joki, who directs our PM&R consult service at Robert Wood Johnson University Hospital, which is a level 1 trauma center. These patients make about 40% of our JFK Johnson inpatient census. You'll also be exposed to trauma cases, strokes, and learn a different style of consult service, further advancing your knowledge and experience. Finally, you work with Dr. Van Dien, who's a sports medicine board certified physician who helps lead our monthly 2-hour ultrasound curriculum within didactics for the residents as well as med students, giving us a more hands-on experience with the ultrasound. There is also an OSCE at the end of the year to assess our clinical competency as well as ultrasound technique and diagnostics.
We also get pain and interventional experience with Dr. Parikh and Dr. Delaveau, who are ABMS board certified in pain medicine. Dr. Parikh is also our Pain Medicine Fellowship Program Director. Our senior residents spend time with this team getting spinal interventional experience in the Metaplex across the streets. Outside of our core curriculum, we have the opportunity to participate in a number of different courses at nearby institutions, such as UPenn for a prosthetics course and also an ultrasound course, MOS Rehab for a gait and orthotics course, Jefferson for an EMG course, Rutgers Robert Wood Johnson for a cadaver course, and the New Jersey Society of PM&R, which frequently includes ultrasound workshops. Lastly, we also go to AAPM&R for the practice management course there. We also take part in a number of workshops here at JFK, including one on tracheostomy management, one also on musculoskeletal injections, a spasticity workshop, and as mentioned before, ultrasound. Resident wellness is an essential part of our residency culture, and we partake in quarterly, program-funded wellness events throughout the year to take a break from clinical duties and focus on our wellness. Recent events have included Topgolf, bowling, rock climbing, paint night, among others. We also have the opportunity to attend a number of national academic conferences each year. Unique to our program is that in addition to the organizational stipend, Dr. CUCCURULLO's Board Review Book Fund provides extra financial support for the cost of attendance for the residents. We wanted to also mention other prominent individuals in the program, including Beverly Bolger, the PM&R Residency Program Director, and Lisa Lopez, the Fellowship Program Coordinator. You'll also get the chance to work with our amazing nursing and therapy staff as part of our multidisciplinary teams. If you have any questions at all, please feel free to reach out to Dr. CUCCURULLO, Dr. Leslie Bagay, Beverly Bolger, or our chief residents via their email accounts. We want to thank you for taking the time to watch our virtual tour, and we wish you good luck on your interview trail.